Hello, everyone, and welcome back to the Equipped with Strength podcast. I have a guest with me today. It's Sarah Haig, and Sarah is a pelvic health physical therapist, and she's also, remind me again, the college, your assistant professor at
Rosalind Franklin
Rosalind
University
Franklin.
in
So
North Chicago.
awesome. So, Sarah, the reason why you're on here today is to talk about diastasis recti, and which is also not what people may refer to as an abdominal separation, most commonly postpartum, or it happens during pregnancy and then after pregnancy. And I've been doing a series of these episodes of sort of a Q&A style questions or topics from the audience. And this is one I got from Nadege. She says she recently discovered that she may have abdominal separation. I believe that she's told me before she's had maybe a few pregnancies, and this is why she thinks not having able to get a flat belly when I do get great results in all other muscles. Also, most exercises I was doing to build the muscles are actually make it worse. So I'm frustrated that it's wasting a lot of time and energy. And she thought that this would be a good topic because she's just discovered this. And the long lead into this is really, I've seen this coming up time and time again in groups on Facebook or Reddits and things where people will be concerned about how their stomach looks postpartum. Like they think, oh, I still have like a bulge or I still look pregnant. And even though they're years down the line, and they're concerned about the aesthetics of it and what they can do regarding that. And are they making it worse with certain things? Can that happen? And is there things therefore that can be done to make it better? But there's the other angle, which I see all the time, which is more of you're doing yourself harm. You're going to cause, if you don't fix this, if you don't, like, it's broken and now you need to fix it. If you don't, then you're doomed to have pain or some other kinds of problems down the line. And my whole thing is, I'm wondering, are these things inevitable or are they just fears? Because having been pregnant myself and having these same things thrown at me, I was worried when I saw doming happening. So like, but even before I was pregnant, that sort of thing happened. But when I was pregnant, I was like, oh no, I'm making it worse and making it worse. So maybe you're the expert in this because you probably deal with this a lot. And so maybe we could like unravel some of this from maybe the, first of all, from her angle, where it's like our exercises she's doing making it worse. And is there anything she can do to improve the aesthetics of it? And then maybe we can move into function.
Yeah, so I would have so many questions if your listener would. I wish he could be here so we could talk. Because the very short answer to are you making it worse is no. And when I say that, I'm referring to specifically that diastasis, that separation of the muscles, pulling apart. And that's one part that can contribute to how our stomachs look. But I think if we rewind to pre-pregnancy, some people are gifted with the stomachs they want. So some people aren't, and they have to do a little more work and find out that thing that works for them, to have the results they want. And sometimes genetically, it just might not be your body shape. So there's a lot of things that are outside of our control. But as far as a particular exercise making the diastasis worse, I've seen no evidence of that. Regarding aesthetics, one of the things I can tell you is I'd be very curious the exercises that have been tried. Because in general, and I'm speaking of, there are of course people at both ends of the spectrum who manage to get through pregnancy and have very little diastasis to no diastasis as they recover. And then we have other people who have quite severe diastases. And that isn't because of anything that woman has done. It's, I have seen a woman who was postpartum with twins who literally had like an 8-finger separation between her abdominal muscles. and she got better, right? So
Wow.
there's again, there's a lot that goes into how it looks and how it feels and how it functions. So to kind of, again, go back, I've already answered, you can't really make it worse, but there are certainly things that you could do that would maybe not help you meet your goals. So when it comes to exercises or activities to help with the aesthetics, it's such a case-by-case basis. I've had women who, golly, she came in, she had 3 children. Her youngest was, I think, 5. And she had never sat up straight or reached over her head since her last child was born, because she did have diastasis, and she had been told she would make it worse.
By sitting up straight?
By reaching overhead or stretching her abdominals.
Oh, right.
Yeah. And when she would sit up straight, she felt some pulling and stretching because she never did it, and she'd think that it was bad for her. Well, if any of us slouch, again, regardless of our situation, we're not going to look as good aesthetically as when we're all tall and graceful like dancers. So again, like really thinking about I'm wondering what abdominal exercises are being done, and functionally what might be going on there. Because strong abdomen. Oh, go ahead.
Well, no, what I was going to ask was like, so when we're saying like there's no exercise that you know of that could make it worse, or that is likely to make it worse, like because the ones that we hear all the time, don't do crunches, don't do like twists, don't let your abdomen dome. So like if you're hanging from a bar doing a pull up and you see your abdomen going out, then you have to stop, because that could make it worse. Is that true? Like when you see your abdomen doming, say you're doing push-ups or things like that, because I've noticed, like for me, like my stomach would sit down more now than it would before baby, and I'm like, oh, is there something wrong? Like what's happening here?
That's definitely an area of discussion. And Anthony Lowe, who's the physio detective from Australia, he had a great, I don't remember if it's just a Facebook post or a blog a while back, just like, how do we think it's like, why do we think it's bad? Like, is it just like, is it a pressure management issue? Is it, and these are kind of my thoughts, not his thoughts on it, but I was like, that's a great discussion. Like, so that's happening and it's not ideal. And I'll tell you, when I go to the gym, I see guys have this all over the place.
Yeah.
They're not bothered by it. They keep doing stuff.
Right.
But so I think it's kind of a 2-part answer of, we don't know what it means. I would say that it might be an inefficient way of managing intra-abdominal pressure that maybe we can look at and try to change. But does it mean we shouldn't exercise or do that exercise? And I don't think that we should discourage people in general from doing something that they're enjoying, because we have this idea that we might make something worse. But worse than doing an exercise that looks funny is not doing anything. And that's actually what studies have shown, is that there isn't, and this might lead to another discussion, there isn't one particular exercise or a collection of exercises that has been shown to be effective at reducing diastasis, except there has been some evidence that's pretty good that says exercising is good. So just doing the exercise, staying active, staying healthy is actually one of the ways you can help diastasis in some way.
I even noticed, like before I had the baby, I would have had this, like if I was doing like a V-up or something, some kind of leg raise, I would notice that I would have that doming anyway. And so I never was concerned about it before. It was only when it was on the radar of, babies and being pregnant and postpartum that I started to like a little alarm bell going off. But it's planted, it's a seed, and then you think, oh, it shouldn't happen. Like you say, it's like, well, why are we like, okay, it might mean something that's maybe not as efficient, but does that mean it's harmful? Does that mean that we should like stop doing these things when those are pretty good to be strong and you know, all of that kind of thing. But you know, as to like, I'm thinking about like the member who wrote to me and asked me that, and I feel her pain, because like I would love, like before I was flat stomach, and now it's like, what can be done? So is it a case of getting surgery to fix this sort of thing? Like if you really, really, really dislike how it looks, or an exercise, you've been exercising for a long, you know, pretty well, is it like something that if you address that potential inefficiency in how you're maybe dealing with the pressure inside, that may help? Or like where do we go next? I suppose if somebody really, really can't live with their life looking like this, which is fair, then like what do we do?
Yeah, I will say what I suggest to my patients, because again, surgically, so if you look up, you know, like when I do look around for things for information on diastasis, so much of it again is ends up being directed like cosmetically and surgically. So surgery is definitely an option. But what I would say to my patients who are interested or considering or very concerned about how they're looking, is to, one, make sure that you're giving yourself time. Make sure that you're done having babies, because if you're going to have another one, most surgeons won't consider doing the surgery like this until you are absolutely done having children. But also to make sure that you've given yourself the time to recover. We have to remember it takes 10 months of slow, steady change to make the baby. And then the baby comes out, and that's a big deal. So regardless of how the child is born, it's a commitment and it takes time to recover. And a lot of times, especially here in the States, you know, usually it's like that 6 weeks, you're good to go. Well, you're perhaps healed and not at risk for infection. You're not the way you were. That takes time and some work, right?
Definitely.
So I really advise women to have their goals and work on them for at least a year. It took you almost a year to get that way. Give yourself some time. You know, there's different theories, you know, so like I believe genetics plays a role into it. Some people, these are the people walking out in their skinny jeans from the hospital. Like that's not everybody. But then, you know, there's, you know, like how's your connective tissue going to respond? And then looking at the hormones, right? So we have this amazing ability as women to expand and adapt to having a small human live inside of us. That's pretty cool. And also, again, it's a lot of work and it's a lot of stretch. It can come back, but in many women it does. I think we forget that there's a lot of women not looking for help, right? And I think there's a group of those women who aren't looking for help because they don't know there is help, but there's a group of women who are fine, who do recover. But we just have to be patient. We also have to know that, let's say you didn't have a baby, and if you just kind of stopped exercising and didn't do anything for a year, how would things look?
Right.
Again, genetically speaking, some people would look fine. They would look exactly how they want to look. I would not.
I would not.
So I usually, again, when my pregnant patients are concerned about this, I tell them, please give yourself a good 6 to 12 weeks of rest and walking, you know, like getting back into the swing of things, adapting to a new baby at home, taking care of yourself in that way. Then when you're ready, and once you've been cleared by your doctor, we can get to work, because it's gonna be work. It's rehab, right? And then let's work at it for a bit and get everything in as good a shape as we can. And then let's look at it aesthetically and see what you want to change. I have had patients who have had surgeries, super happy with them. But these are also people who, again, I have a biased sample, right? But these are also people who definitely did tons of work, right? Like, so Pilates 3 times a week. They would check in with me when they needed to. They really took good care of themselves and got them and they felt they were as far as they could get. without surgery, and it was important enough for them to pursue it.
And then I see lots of people talking like this 5 years and maybe, I feel like, I don't know whether it's just my bubble online, but like I've just become more aware of it. And it seems to be people are talking about it more, but that could be totally like what I'm picking up. But, there is coming into people's radar, especially in the UK. I think in the UK, they don't have the same kinds of access, I feel like, to these kinds of specialties and like women's health and pelvic floor and the physio side of things. The sort of postpartum recovery physically for the mother isn't there, I think, from what I read and what I see, and plus having been in the NHS myself as a nurse, I see that happening. So you really have to push for it back in the UK. But I see a lot of these women in like Girls Gone Strong's group, for instance.
Mm-hmm.
They've got a more of an awareness of this, and they're looking for somebody to help them with it. So I guess like what I was maybe thinking of there is when you have a baby, like regardless, is it definite that you need rehab? Like, should everyone who has a baby see a physio postpartum?
I would say yes, with an asterisk.
Mm.
And why I say that is I think it's really hard to talk in absolutes. And like I said, some women end up being fine. But I do think, and again, I'm speaking from my perspective here in the States, but I imagine it's not just a US thing, is that there are lots of questions, and follow-up for the mom after 6 weeks is pretty minimal. And when problems, a lot of times women aren't able to start doing things like have sex or exercise before those 6 weeks. So you don't know what those problems are, but also now you're done really, like, so how do you make another visit? Do you message your doctor? Like, there's just so many unknowns. Like, is this normal and it will get better, or is this something I need to get checked out? So I would say it can be hard. So sometimes one of the things I love is what I'll tell my moms before they, when I'm seeing them when they're pregnant, is look, if there's stuff that's worrying you and it doesn't involve blood or pus, let me know. Like, if it's about stuff that's hurting, even if it's about just leaking urine, shoot me a message and like, let's chat, because sometimes it's just, yep, you're only 2 weeks postpartum. If you're really worried, call your doctor. And also, based on what you're telling me, stuff should get better. But stuff like pain, I always say, like, if you're hurting to the point that you're unable to take care of your baby and take care of yourself, that's a time that we have to ask for help. So when I get to get them on the front side. I think there's a lot of women postpartum who don't know that there's help, don't know that there's support. And unfortunately, sometimes when they do reach out, either to family or to their healthcare team, they're like, oh, that's normal. You had a baby. But there's so much we can do. So should every woman? I hesitate to say yes, but would it be great to have a qualified pelvic floor physio check out the things that might be of concern, make sure that everything's going well? I think that should at least be an option for every woman.
Yeah. I see, I follow a few people on Instagram, and they were talking about they're doing their rehab and their things, and I'm like, gosh, I never did any of that. I was stubborn. I was like, I don't need any of that. But then I actually reached out to you because I think it was like initially I was more or less fine, given that didn't sleep, but after several months I started developing a hip pain, and it was just severe. Like, I was not able to get up and down off the ground. It was just terrible. And Jonathan had to help me off the toilet one night. It was so bad, and it just got to the point of like, okay, I think I need to go see somebody now. But thankfully it took about a year, but it did go away. So that's, I guess this kind of is a nice segue into the functional stuff, or what is when does it become so let's go back to diastasis recti on its own. Does it ever lead to dysfunctions? So if you have somebody who maybe has incontinence or issues with pain, what are the chances that it's because of the diastasis recti?
very low, actually. There's been some really good studies in the last couple of years, including a clinical practice guideline by Susan Clinton, just kind of looking at the evidence surrounding pain. And there really isn't strong evidence to link diastasis recti to things like pelvic or low back pain, incontinence, pelvic organ prolapse, anything like that. So we may have women who have pain and also happen to have a diastasis, but blaming the pain on the diastasis or thinking as the woman or the clinician, you can't get better until the diastasis resolves is not correct. And I think that that's great news, because we actually can't control the formation of the diastasis. Like we want the baby to get as healthy as it can be, grow as much as it can. And there's actually been shown, I wish I could remember the exact study, but where women who had a diastasis actually had less incidence of pelvic organ prolapse than women who didn't develop a significant diastasis. And I'm like, right, like pressure management, like it's got to go somewhere. If it's not going out, it might go down. So it's, I have trouble even calling a diastasis a dysfunction, because I think it's probably a normal physiological response to the process of pregnancy. But again, to go back to your original question, is that there hasn't been any linking in the research world of diastasis to really any sort of pain or dysfunction in that way.
That's reassuring. And I remember maybe about, it must have been 2013. It was before I got married, but I had a client who was postpartum. She'd had 3 pregnancies very close together, and she was worried about making it worse and things. So it was way back then, or before I kind of knew a little bit more. And I remember stumbling upon things about alignment and like having your pelvis and your rib cage in alignment, and having your breathing and your pelvic floor, your diaphragm working together in a piston and all this stuff. And it felt like a lot of work mentally to like try to synchronize your body in a way that was so like who has the time and energy, especially after now that I've had a baby, like who has the time and energy to nitpick their breathing and their alignment 24/7? You just can't do it. So do you need to do that? Like, is that something that helps? Or like, I'm talking about not necessarily the diastasis recti, but like more about I suppose then we move into more of the pelvic floor issues that maybe would pop up, or even pain. I was even doing it even before I had a child, because I was like, oh, maybe this is why I have pain. like maybe I'm just not aligned properly. So I went down that rabbit hole. Is there any use to doing that?
Yeah, so again, I feel like there's always, like the 2 extreme ends to a spectrum, and someplace in the middle is usually pretty helpful. So the piston, you were like, I know Julie Reeb, and that's kind of her explanation, and I actually really love her work. And they're like, depending on how you come at it, there can seem to be a lot of nitpicking about alignment, and I would say in general, trying to find a perfect alignment is exhausting and usually doesn't work. It takes too much to like do it regularly. And alignment, we're dynamic creatures, right? So like I can get myself in perfect alignment, and then what? Like, do I stay there? I'm gonna have to move. One of the things I really like about Julie's perspective is actually the breathing. And we can even do it right now, that like, so I'm kind of slouching out a bit. And like, if you try to take a breath in a position you're in, and then you change it in some way, and usually like, so like if I get taller, I'm going to feel a change of the relationship between my pelvis, like, like my tailbone sticks out a little bit more. And then you just take another breath. And one of the cues I'll use for people is to like, was that less effortful? Like, was it somehow easier, more efficient. And that can help, because when we think about the pelvic floor and the diaphragm and how all that works together, this is a way to help manage pressure. To you know, like with the breathing, if you hold your breath, the pressure in there goes up. So it's also kind of a way to think about not holding your breath or gripping or things like that. Because that's another thing I have seen with some of my women in particular who have issues with diastasis, is they are scared to let their abs relax.
Yeah.
So to kind of like find that, like, where can life be a little easier, even if it takes a little brain work to get there. So that is, again, another very long answer to your question.
It's helpful.
I think that the breathing can be helpful, and that all of our own personal best alignment is going to vary. So I just try to help people find where they feel better, and then see if they can just feel better more often. It's hard because it's still change. Even change that feels good can be hard to keep up.
Definitely.
But yeah.
You know, it's interesting that, you know, the breathing thing, it feels good, like at the time, and the stomach thing, right? So this is a thing that letting your stomach relax is so difficult. I think well, for anyone who lives in the Western world, and we're obsessed like with how flat your stomach is, but for women especially, you know, you're just forever holding it in, especially if you feel frumpy, or you know, God forbid you're fat or whatever. Like, you know, the silly things, the pressures and things that add to that then you're like, and it's so hard to get out of the habit, especially if you've been doing it your whole life or since you were like a teenager. And is that something, like, what are the like, do you know anything, if they've done research into this, like what are the benefits of actually just letting your stomach relax rather than always holding it in? Does that influence other issues that may pop up over time? Because I think what can happen is, like, we can villainize, even though it's maybe vain, on, you know, a vanity driven thing, but in some cases people suck in their stomachs because they think it's going to make their, you know, their core more stable and their back safe and all of these things. I guess I'm trying to, hoping a question's going to emerge from all of this, but hopefully, I guess my question is, like, should we worry about either way holding it in, or is it better to let it relax, or like, where is it that sort of, there's two ends of the spectrum, and sort of being fluid in your tension and relaxation thing, that's maybe a better idea.
So that question emerged beautifully. And again, like so many things in life, to a degree, it kind of depends. One thing I would say is this belief that we need to like be stiff in the middle, or like, you know, like have a strong core. Somehow we translated having a strong middle to having a very tight, stiff middle. And our back isn't weak. Even if we don't do that, even if we don't grip our abs, our spines are strong and resilient, and we have all those bones. Instead of like a rod of bone, we have all those little bones so they can move. So one of the things so you had asked about research, and I actually don't know of any research like looking at like gripping abs versus not gripping abs. I can tell you that it can be really hard to move, and moving tends to feel good. So if we grip our abs, a lot of times, depending on how we're gripping them, we're not moving in the middle very much. And that doesn't feel good. Moving, if it doesn't feel good, we should work on that. But most of the time, what do we do when we get out of like an airplane or a car ride, right? Like we kind of like, oh, like we have a wiggle and a stretch because we haven't been moving. But then if we kind of go to like the aesthetics point of view, one of my favorite things to do with women, and this might get me in trouble with some people, but with women who have diastases, is I have them actually stretch their abs. because that's such a foreign thing for them in some ways, because again, they probably have been gripping their abs, and they've also been told to not do a whole myriad of things depending on where they've been online and in the real world. But actually stretching and relaxing those abs lengthens those muscles. And if we think about, even if we go back to the aesthetics perspective, so our right, so our rectus goes from like the bottom, like our xiphoid process, bottom of our ribs, to our pubic bone. If we tense up a muscle or shorten a muscle, what happens?
Okay.
Like if we think about it like in the biceps, so what happens to my well, it's not going to be very impressive, but right, so it kind of gets bulkier and shorter, which is the opposite of what most of us want our abs to look like. So I don't want to oversimplify or minimize the distress that women have when they come in to see me, but a majority of the time I'll see my patients who have diastasis 1 to 2 times, and usually it's because we just have them lengthen in the front. Can you make your pubic bone farther away from your rib cage? And that does result in like a little bit of an anterior pelvic tilt, but just lengthening those muscles and allowing them to kind of come together gives them the look they were looking for.
Wow.
So that's, again, like kind of a long way around to say, like, we're meant to move. We can be strong and mobile. In fact, I'd argue that's probably the way we were meant to work. So to have a long muscle isn't the problem. Having muscles that aren't working as maybe they could be is usually more of a limiting factor.
Yeah, so it's like you're kind of restricting the things that you do, and this sounds like victim blaming, but it almost becomes a self-fulfilling prophecy, because and then you think about that, what's the posture that you're in most of the time when you have a newborn or kids, is this hunched over holding and cradling a baby, and you're not exactly ever really upright. Like you just can't, you're constantly just in a heap. You just, and so it would feel so good just to stretch out of that. And yes, when you were saying that, I was just like, I would probably never do that, because when I was believing all that stuff, or when I believed it was going to make things worse. But now it's just a forgotten thing to do, because I'm so wrapped up in like motherhood and busy life, and it's just so nice to stretch it out. So have you come across anything else that may be worth saying to people who maybe are concerned about whether or not they're immediately postpartum, or whether or not they're years down the line, in terms of like what they might be worrying about, or what they might be sort of thinking what to do next, just before we kind of wrap up?
Yeah. So I would say, if regardless of where you are on the journey of life, if there's something, especially, I mean, this topic is on diastasis, if you have questions, concerns or worries, ask. Hopefully you can find a great practitioner close to you. If you're not sure how to do that, or you have questions about what you're hearing, you're welcome to reach out to me on social media, and I'll see if I can find someone, or at least one of the things that, because I don't know everyone in the world, obviously, is to come up with some good questions to ask the practitioner. But mostly to both women and practitioners, practitioners don't scare people. Women, if you're feeling scared, we probably need to find you a different practitioner, because our bodies are amazing. They're strong, they're resilient, they can get better. And sometimes they just need a little extra help and guidance. But really, you're magical, and you can make a huge difference. And if you hit that point where everything you're doing isn't making the difference, then there are other people to help with surgery or other options. But if you're feeling lost and alone, one, you're actually not alone. There's a lot of women who feel that way. But also, just know that there is help, and whatever you're doing, you're not making yourself worse. So if you want to try something, try it.
That's the best thing to hear. It's like you're not doing anything worse because you're so afraid of doing something in case it's wrong. And like the person who wrote in, she thinks that all the things she was doing was a waste of time. And that makes me so sad, because then it's like all that effort, but it hasn't gone to waste because she's been active and she's been working and getting stronger. And doesn't mean that necessarily those things have helped, but maybe other things could, and she can keep trying and not worry and not need to worry that it's going to make things worse. So that is always the most reassuring thing for me to hear. So Sarah, thank you so much. Where can people find you? You're on Twitter, I think.
I'm on Twitter more than other things. I think it's because I'm old. I know all the cool kids are on Instagram, but I'm just at Sarah Haig PT. And then my clinic website is entropy.physio. And it's my email is on there and some other information as well.
Well, thank you very much for being here. And anyone else, if you have any questions, even follow-up questions to this topic, and also we're continuing with these Q&A sessions, so you can reach out to me at Marianne@equipwithstrength.com, and we will be back soon with more.